Sister Love is an NGO with a community-centered approach in providing support on issues affecting women, vulnerable and marginalised populations of society. As the country commemorates National Women's Day, the role that women play in health and human rights advocacy for their communities is recognised significantly by using lived experiences of women and their challenges. Health advocacy also seeks to address spheres within society and policy frameworks that continue to marginalise women. Gender-based violence, women's reproductive health rights, HIV/AIDS, stigma and discrimination, and issues of human rights are just some of the key support programs that Sister Love focuses on. We'll speak a little bit more on this and the importance of women-led advocacy work. Nontyatyambo Makapela is the program officer of Sister Love, joins us now on the line. Thank you very much indeed for joining us, and welcome to the program.
Thank you very much, Peter, and to the viewers.
So what is the significance of women-led advocacy work in addressing issues affecting women in their communities, in your view?
Okay, because when we are looking at sexual and reproductive health and rights, HIV, gender-based violence, violence against women and femicide, it has a woman's face. We know that we are the mostly affected group in our society. So for us as a Sister Love, it's quite important that when we design the programs in our communities, they respond to the realities or lived experiences of women. So for us, it's so significant to have women to be at the forefront in making sure that all the challenges that are being addressed or the programs that are being developed, they are led by women. And we are not saying we don't want men, but at the same time, I think it is quite important that men can be supportive, and we are the ones who are speaking based on our own lived experiences.
Has that made a difference in your experience so far?
Yes, it has, because the work that we are doing in communities, that is, Sister Love is creating safe spaces with other community-based organizations so that whatever decisions that are being made are women-centered. And we are seeing that as well because we are capacitating adolescent girls and young women at an early age. They are the ones who are at the forefront so that whatever policies that we develop, it's informed by the experiences that we have as women.
What are you finding are the biggest issues that women and young women are facing nowadays, particularly when it comes to health issues?
Okay, HIV new infections is still a problem for adolescent girls and young women and women in general because of various factors where we are mostly not working or we are financially dependent on our partners or we are expected to negotiate safer sex. And at the same time, we know when a young woman is trying to access health, sexual and reproductive health, like your contraceptives, your prevention measures for HIV, there is still a stigma or attitude from the healthcare workers. So those are some of the challenges that we are experiencing as women. And if you are looking at gender-based violence, we know that it's a violence happening on the basis of gender, but violence against women is the main challenge that we are experiencing. And if you are looking at the COVID-19 at this stage, it makes it worse for us to be able to access healthcare services, to go to clinics for screenings, because now the only message that is very clear is around the COVID-19, whereas we are still sexual beings and we are supposed to go to clinics and access the safe measures to prevent ourselves.
I suppose it becomes extra difficult for young adolescents because they're so young. It's difficult, to talk about some of these issues, and we often hear stories about their difficulty when they get to healthcare facilities and how they're treated. Okay,
one of our role as Sister Love is to educate, and also we do the advocacy work. Our primary recipients or beneficiaries for our project is adolescent girls and young women, not forgetting their sexual partners. But you will also understand, as part of their development, young people, they need to be supported and to be guided. So our main role as an organization is to do the education, create that safe space that is very non-judgmental, so that as they are growing, they are able to identify and learn about their sexuality, about their bodies, so that when they make choices, they are informed based on information that is going to assist them in future. And also we sensitize healthcare workers. We will understand that sometimes we don't have enough friendly clinics, in South Africa, but there should be a role that is being done by government in making sure that they are committing. Our role is to educate, but if the government should be able also to play its role in making sure that those environments, they are very safe for young people, because they are developing their sexual beings as they are growing. Some of them, they are exposed to some of the sexual violence at home, but they also need to go and access healthcare services, sometimes without even informing their parents or guardians.
All right. What's the most important message you'd like to leave our viewers with tonight as we continue to mark Women's Day? And from your perspective, as someone who's concerned about healthcare?
I think it is important that we create a space for young people to speak for themselves. And even with the policies that we have, it is important that we make a government to be accountable when they are violating the rights of human beings, and especially for adolescent girls and young women. All of us are equal before the law, but I think it is also important that we create that space to be safe for everyone, and especially for us as vulnerable groups, which is adolescent girls and young women, LGBTQI communities, including the sex workers as well.
Thank you so much indeed, Ms. Makapela, for joining us, and we wish you the best as you continue to do great work with Sister of Love. Thank you so much.
You're most welcome. Thank you very much for the opportunity.